Have you ever felt an odd heaviness in your legs? Or a dull ache that just wouldn't go away? Maybe it creeps in after a short walk, or settles in while you're just sitting quietly. It's easy to think, well, I guess that's just part of aging. But here's the truth. Not all leg discomfort is normal. And it might be your body whispering that something more serious is going on. In fact, one of the most overlooked causes of leg pain, swelling, or tightness, especially in older adults, is something called a clogged vein. Now, when people hear that term, they often imagine a dramatic emergency situation, but sometimes a blocked vein doesn't feel dramatic at all. It can come with subtle signs, a little swelling, a strange sensation of pressure, or even just fatigue in one leg. And if you ignore those early hints, the risks can quietly build. Left unchecked, a clogged vein can lead to complications like deep vein thrombosis, or even a potentially fatal blood clot that travels to your lungs. That's why today, we're going to help you understand how it really feels when a vein is blocked, how it's different from other vascular issues, and what warning signs you should never ignore. Before we jump into those symptoms, let's take a quick step back and look at how blood moves through your body, because once you understand that, everything else will make a lot more sense. Your body has an incredible transport system. Arteries are the highways that deliver fresh, oxygen-rich blood to every corner, to your muscles, your skin, your organs. Once that blood does its job, veins take over. They're responsible for collecting the used blood and bringing it back to your heart, where it gets sent to the lungs for a fresh supply of oxygen. But that's not all. There's a third system working quietly in the background, the lymphatic system. These vessels help manage fluid levels, remove waste, and fight infection by draining away excess fluid and toxins. When everything is flowing well, you probably don't notice a thing. But if there's a blockage, especially in the veins, the signs start showing up. Pain, swelling, numbness, or heaviness in your legs might seem mild at first, but they're often the body's way of saying, hey, something's not right. And here's where it becomes especially important for seniors. As we age, our circulation naturally slows down. The muscles in our legs may weaken, and the tiny valves inside our veins, the ones that help push blood upward against gravity, might not work as well as they used to. That makes older adults more vulnerable to clogged veins and slower blood flow. So if you've ever looked down and noticed one leg looking puffier than the other, or if you've felt a weird tightness in your calf that eases only when you lie down, don't brush it off. Stick with us, because in the next few minutes, you'll learn exactly what these signs could mean and how to take action early, before things get serious. Now here's something that often causes confusion, and it's perfectly understandable. Many people hear the term blocked vein and assume it's all the same as a clogged artery. But in reality, these are two very different problems, and they feel very different too. Let's break it down in the simplest way possible. Arteries are like the delivery trucks we talked about earlier. They bring fresh blood out to your body. So when an artery is blocked, your muscles, skin, or even toes don't get the oxygen they need. This kind of blockage is dangerous and can be sudden. You might feel severe pain, your skin could turn pale or bluish, and in some cases, the limb might feel cold or even go numb. It's a medical emergency. On the other hand, veins are responsible for bringing blood back to the heart after your body has already used the oxygen. When a vein gets blocked, it doesn't always hurt right away. Instead, blood starts to pool in your legs. You might notice swelling, heaviness, or a dull ache that worsens throughout the day. Sometimes, you'll feel a tightness deep in the calf, or a strange pressure that only eases when you elevate your legs. It's quieter, slower, but just as serious if ignored. And to make things even trickier, sometimes, people use the term vein blockage when they're actually dealing with something in the lymphatic system, or a misbehaving valve in the veins causing backward flow, not an actual blockage. So it's not your fault if you're confused. The terms get thrown around a lot. That's why learning to tell the difference can help you take the right steps early before symptoms get worse or complications set in. Next, we'll take a closer look at what it really feels like when a vein becomes blocked, both in sudden cases and in those that build up slowly over time. Now, let's talk about what happens when a vein gets blocked suddenly. This is what doctors call acute venous thrombosis, and while the name sounds technical, what matters is how it feels and how fast it comes on. Imagine one of the main veins in your leg getting clogged by a blood clot, like someone plugging up a pipe with a cork. Blood can't move past the blockage, so it builds up behind it. Pressure rises, and the symptoms appear, often quickly and without much warning. The most common signs: swelling and pain. And not just a little discomfort, we're talking about swelling that gets noticeably worse within a few hours, and pain that feels deep, heavy, or even throbbing. Some people describe it like their leg is tight or about to burst. You may also notice warmth or redness in the area. Sometimes the skin becomes shiny and tight from the pressure. One leg may look very different from the other: fuller, warmer, more tender to the touch. And here's where it gets dangerous. If that blood clot breaks loose and travels up through your veins, it can reach your lungs. That's a pulmonary embolism, a life-threatening emergency that can cause sudden shortness of breath, chest pain, or even collapse. That's why recognizing acute vein blockage early is so important. It's not something to wait and see if it goes away. These symptoms often appear within hours, and they tend to get worse, not better, on their own. We know it's tempting to ignore a little swelling, or blame it on just sitting too long, but if you notice new swelling in one leg, paired with pain, warmth, or color changes, don't delay. Especially if the pain gets worse when you stand or walk, but improves when you lie down and elevate your leg. If you catch it early, doctors can run simple tests, like an ultrasound, to see what's going on inside your veins. And the right treatment, started soon enough, can prevent serious complications. Your body is wise. If something suddenly feels off, it's always better to check than to regret. While acute vein blockages come on suddenly and often feel dramatic, chronic vein blockage is much sneakier. It doesn't shout, it whispers. And if you're not paying attention, the signs can blend in with what we often think of as just normal aging. But here's the truth. When veins are slowly narrowing or damaged over time, maybe from previous clots, injuries, or poor circulation, blood struggles to return to the heart. Instead, it starts pooling in the legs, leading to long-term swelling, heaviness, and sometimes even skin changes. At first, the signs might seem minor. Your legs feel a bit more tired at the end of the day. Maybe your shoes feel tighter in the evening. Or there's a dull ache in your calves after standing too long. You might think, that's just how it is when you get older. But over time, these symptoms can grow worse. The swelling becomes more frequent. Your legs may feel tight, itchy, or even throb at night. The skin around your ankles might darken or take on a leathery texture. In some cases, small wounds, especially near the lower legs, heal very slowly or keep coming back. That's chronic vein blockage in action. This condition is especially common in people who've had deep vein thrombosis, DVT, in the past, or who sit or stand for long periods of time. Even past surgeries, weight gain, or lack of leg movement can contribute to it. And because it develops gradually, many seniors ignore it for years, until it starts affecting their ability to walk, sleep, or stay active. But here's the good news. Even though chronic vein problems can't always be reversed, they can absolutely be managed. Elevating your legs regularly, wearing compression stockings, staying active, and seeking treatment early can make a big difference. So if you've noticed changes that don't feel urgent, but don't feel quite right either, don't write them off. Your legs are trying to tell you something, and listening now could help you stay comfortable, mobile, and independent longer. Next, we'll talk about a special kind of pain some seniors feel when walking. One that may not seem obvious, but is a classic clue of serious vein obstruction. Now here's a symptom that often slips under the radar, even for people who've been living with vein issues for years. It's called venous claudication, and while the name might sound fancy, the experience is something many seniors are all too familiar with. Have you ever gone for a walk, and after just a short distance, felt a tight, aching pain deep in your calf? It's not the kind of pain that makes you cry out, but it slowly builds, gets heavier, and forces you to stop. Then, strangely, when you sit down and elevate your legs, the pain fades away, almost like magic. That's venous claudication. It happens when the veins in your legs are partially blocked or damaged, and can't move blood back up to the heart fast enough. The harder your leg muscles work, like during walking or climbing stairs, the more blood flows down, but can't return properly. That pressure builds up, causing pain and swelling that only improves when you stop moving and let gravity help the blood drain. This type of pain is often mistaken for muscle fatigue, arthritis, or just getting older. But it's not. It's a clear sign that your veins are under serious strain. What makes venous claudication especially tricky is that it tends to show up only with activity and then quietly go away when you rest. That's why so many people ignore it for months or even years until walking becomes a daily struggle. But it doesn't have to reach that point. If you recognize that your pain goes away when you elevate your legs, that's a big clue it might not be muscle-related. And if it always shows up in the same spot, or gets worse the longer you walk, it's time to speak to a doctor. Because even though venous claudication won't always show up on the outside, your veins are working overtime inside, and they need help. In the next section, we'll talk about another common misunderstanding: how varicose veins, while not always dangerous, can sometimes mask more serious vein problems underneath. Many people think of varicose veins as just a cosmetic concern, something that looks unpleasant but doesn't really harm you. And yes, in many cases, varicose veins are more of an aesthetic issue than a medical emergency. But that's not the full picture, especially for seniors. Let's talk about what's really happening beneath the surface. Varicose veins form when the valves inside your veins, those tiny flaps that keep blood moving upward, become weak or damaged. Instead of closing tightly, they start to leak. This allows blood to flow backward and pool in the vein, causing it to stretch, twist, and bulge over time. That's when you start to see those blue or purple veins snaking across your legs. At first, they may not hurt. You might simply notice them when you look in the mirror. But as the condition progresses, many people begin to feel a heavy aching sensation, especially at the end of the day. There may be swelling around the ankles, a feeling of tightness or warmth, and legs that tire more easily. For seniors, this can interfere with daily routines. Just walking around the house or standing in the kitchen can become exhausting. Over time, the skin around varicose veins can become itchy, dry, or discolored. In more advanced cases, small sores, known as venous ulcers, can develop, particularly around the ankles. These can take a long time to heal and may come back repeatedly. What's also important to know is that varicose veins are often a sign of deeper venous problems. While the visible veins are near the surface, the real issue might lie deeper inside, where bigger veins are also weakened or blocked. That's why it's never wise to dismiss varicose veins as just a cosmetic thing. They might be your body's way of warning you that your circulation is struggling. If you notice that your veins are getting more prominent, or if you start feeling discomfort, tightness, or skin changes in your lower legs, it's worth talking to a doctor. With the right treatment and early care, you can avoid complications and keep your legs feeling lighter, stronger, and more comfortable. Sometimes, your body doesn't shout, it whispers. But when it comes to your veins, there are moments when the signs become louder, clearer, and far too important to ignore. So let's talk about the red flags, the warning signs that something more serious could be happening in your veins, and that you need medical attention as soon as possible. The first big one is sudden severe swelling in one leg. If your leg looks noticeably larger than the other, feels warm, and is tender to the touch, especially if the swelling came on quickly. Don't wait. This could be a sign of a deep vein thrombosis, or DVT, which can lead to a potentially fatal pulmonary embolism if left untreated. Next is persistent pain that doesn't go away when you rest. If you feel throbbing, pressure, or burning sensations in your calf, especially if it worsens when walking, and doesn't fully ease when elevating your leg, that's a sign your veins may be under serious strain. Skin changes are another big clue. If the skin on your lower legs or ankles becomes darker, shiny, or feels tight like it's being stretched, it means fluid is building up under the surface. And if you notice redness, hot spots, or signs of infection like oozing, don't assume it will go away on its own. Open sores or ulcers that are slow to heal, especially near the ankles, are one of the most serious signs of poor circulation. These wounds are often painful and can easily get worse without treatment. Also, if you suddenly experience shortness of breath, chest pain, or a rapid heartbeat, especially after noticing leg swelling or pain, this could be a sign that a clot has already moved to your lungs. It's a medical emergency. Don't wait. Call for help right away. We understand that many seniors tend to minimize their symptoms. You've lived through a lot. You know your body, but vein issues can escalate quickly and quietly. So if something feels off, one leg heavier than the other, skin that's changing, pain that won't go away, don't brush it off. These are not signs to monitor later. They're signs to act on now. Your legs are your foundation. When they start signaling for help, listening could protect not just your comfort, but your life. So now, you might be wondering, when exactly should I see a doctor about my veins? The simple answer is, don't wait for it to get bad. If you're noticing any consistent swelling, unexplained leg pain, or skin changes that won't go away, it's time to get it checked. Especially if these symptoms are only affecting one leg, that's a major clue something could be wrong with your circulation. Even if the symptoms seem mild, like feeling heavy legs at the end of the day, or veins that are becoming more visible, these can still point to early vein dysfunction. Catching these issues early often means simpler, less invasive treatment, and better long-term results. So who should you see? Look for a vascular specialist, a doctor who deals specifically with arteries and veins. They can perform a quick, painless ultrasound to check your vein function. In many cases, this test can be done right in the clinic and give answers the same day. You don't need to wait until you're in unbearable pain. You don't need to suffer in silence. The truth is, too many seniors delay care because they think vein problems are just part of getting older. But ignoring your veins can quietly lead to bigger problems, ones that are harder to treat later. So if your legs are talking to you, listen. Whether it's discomfort, swelling, color changes, or just a sense that something isn't quite right, take the first step. Ask your doctor. Get clarity, because a simple check today could prevent a serious issue tomorrow. The good news is that while some vein issues are hard to avoid entirely, there's a lot you can do to keep your circulation flowing and your legs feeling strong, especially as you age. Let's start with something simple. Movement. You don't need to run marathons or hit the gym every day. Just gentle, regular movement, like walking around the house, light stretching, or short strolls outside, can go a long way. Every time you move your legs, your calf muscles help pump blood back up toward your heart. Even ankle circles while sitting can help. If you spend a lot of time sitting or lying down, try to change position often. Avoid crossing your legs for long periods. If you're watching TV or reading, take a few minutes every hour to stand up or walk around. And if standing for long periods, shift your weight from leg to leg, or wear supportive shoes. Another powerful tool, leg elevation. A few times a day, lie down and prop your legs up on a pillow or a cushion, ideally above heart level. This helps blood flow more easily back to the heart and reduces swelling. Compression stockings can also make a big difference. They apply gentle pressure to your legs and help support proper blood flow, especially if you've had vein issues before. Your doctor can recommend the right type and fit for you. Don't forget hydration. Drinking enough water helps keep your blood from becoming too thick, which makes it easier for veins to do their job. And try to avoid long stretches without fluids, especially in hot weather. Finally, watch your diet. Eating foods rich in fiber, antioxidants, and healthy fats can support good circulation. Think leafy greens, berries, salmon, and whole grains. Too much salt, on the other hand, can lead to fluid retention and swelling. It doesn't have to be complicated. Just small daily habits, done consistently, can make a big difference. Your legs carry you through life. Let's return the favor by giving them the care they deserve. By now, you've seen how our legs and the veins within them are constantly speaking to us. Not through loud cries or dramatic warning signs, but through small quiet signals, a bit of swelling, a heaviness at the end of the day, a dull ache that lingers longer than it should. And while it's easy to brush these things off as just getting older, the truth is, they're often your body's early way of asking for help. The good news is that you don't need fancy treatments or big changes to start protecting your vein health. Sometimes the most effective things are the simplest. Walking a little each day, elevating your legs in the afternoon, drinking more water, or simply taking a moment to check in with how your legs feel. These small actions, done regularly, can go a long way in keeping your circulation strong and your legs comfortable. What matters most is learning to listen. Your legs have carried you through decades of life. They've walked you through milestones, stood by you through long days, and helped you stay independent. They deserve your attention, your care, and your kindness. So the next time something feels off, one leg swollen, strange pressure, skin looking different, don't ignore it. Take a pause, check in with yourself, and speak to a doctor if something doesn't feel right. Acting early is not overreacting, it's wisdom. We'd love to hear from you. If you've ever experienced leg symptoms like we talked about today, or if you found something that helps you feel better, leave a comment below. Your experience might comfort or guide someone else going through the same thing. And if this video helped you, we warmly invite you to stay with us. Subscribe to Senior Health Tips, your safe space for everyday wellness after 50. Let that notification bell keep us connected, so every time a new video is out, you'll be the first to know. Take care of your legs, take care of yourself, and we'll see you again very soon.